I am Kyla Panchito, and for this video, we are going to demonstrate the lower leg, tibia and fibula in AP projection, lateral projection, mediolateral, and in AP oblique projection, the medial rotation and the lateral rotation. For this projection, as well as the lateral and oblique projections described in the following sections, the long axis of the IR is placed parallel with the long axis of the leg and centered to the midshaft. Unless the leg is unusually long, the IR will extend beyond the knee and the ankle joints enough to prevent their being projected off the IR by the divergency of the X-ray beam. The IR must extend from 1 to 1.5 inch beyond the joints. When the leg is too long for these allowances and the size of the lesion is not known, two images should be made. Diagonal use of the 35 by 43 cm IR is also an option if the leg is too long to fit lengthwise and if such use is permitted by the facility. The patient is placed in a supine position with an 18 by 43 cm image receptor. Now we're going to adjust the patient's body so that the pelvis is not rotated. Adjust the leg so that the femoral condyles are parallel to the IR and the foot is vertical. Flex the ankle until the foot is in the vertical position. If necessary, place a sandbag against the plantar surface of the foot to immobilize in the correct position. The central ray is perpendicular to the center of the leg. Now for our next projection is the lateral projection, mediolateral. Still, the patient will be in a supine position with the 18 by 43 cm image receptor. Now we're gonna adjust or turn the patient toward the affected side with the leg on the IR. Adjust the rotation of the body to place the patella perpendicular to the IR and ensure that a line drawn through the femoral condyles is also perpendicular. Flex the knee 45 degrees to ensure that the leg is in a true lateral position. The central ray is perpendicular to the midpoint of the leg. Next, we're going to have the AP oblique projection, medial rotation, and lateral rotation. First, we'll have the medial rotation. So we're going to medially rotate the leg of the patient to 45 degrees. Here we're going to demonstrate the proximal and the distal tibiofibular joint. And our central ray is perpendicular to the mid-leg. Next one is the lateral rotation. So we're gonna laterally rotate the leg in 45 degrees. Here we're going to demonstrate the fibula superimposed by the lateral portion of the tibia.